Woohoo! And I'm going to shut my door because I can hear myself on Mindy's computer, and that's just dang annoying. And of course, that's also not recorded. All right. And there we are. All right, Jim, here's your private tutorial. All right, so we're going to talk today about the Virginia Rural Health Telecommunications Consortium, which is the group we're trying to pull together, and wanted to give a chance to give folks some information about this and see what questions everybody had. So just a little bit of background for anybody who's not familiar with VRHA. We're an affiliate of the National Rural Health Association, a nonprofit advocacy organization with about 1,000 members statewide. And our members represent the full spectrum of health and healthcare in rural Virginia. Pretty much any type of healthcare thing, if they have an interest in rural, we've got them. And so our mission there, we're going to be talking specifically about the fostering cooperative partnerships. So with that, we've gotten interested into tapping into the Healthcare Connect Fund telecommunications program through the FCC because, of course, broadband connectivity has become so very important for healthcare currently. Really looking at the need to improve broadband connectivity in our rural communities and for our rural healthcare providers. So last year, we applied for and received a grant from VRHA specifically to support the development of this consortium. And we're receiving mentoring from the Indiana Rural Health Association. You're going to hear more about that here in a little bit. So with that, there are a couple of existing consortiums in Virginia. One is the Department of Health, who has one set up for all of the local health departments. The other one is through the Universities of Virginia with their telehealth program. So many of the healthcare providers that participate in their telehealth program are also part of that UVA consortium. So part of what we've done with this is look at some of the model programs that are out there in other states. One is the Indiana Rural Health Association. One of their projects pulled in $16 million in FCC funding, and we're able to lay fiber to 35 sites across rural Indiana. Another model program out there is the Colorado Telehealth Network, who was able to pull in nearly $18 million in FCC funding. And obviously, we would like in on this game. So with that, I'm going to turn it over to Allie Orwith, or Indiana Telehealth Network. Allie?
Hi, thanks for having me today, Beth. We really appreciate being here, and we're happy to help Virginia get on the telecommunications train. So the Indiana Telehealth Network is who I represent. Again, as Beth said, my name is Allie Orwig, and I'm the project coordinator for that. We are part of the Indiana Rural Health Association. They're like our parent company. And the ITN was formed in 2009 as part of the Rural Health Connect pilot program. And I will go into the hierarchy of how that all fits in from the FCC in just a moment. But as Beth mentioned, we were given under the pilot program $16 million to promote the building, installation, and monthly recurring charges associated with getting broadband into our rural healthcare providers around the state of Indiana. We had over 200 participants between the pilot program and the new Healthcare Connect Fund. They didn't all become members, but we've had over 200 different sites participate with us in some shape or fashion. And currently we're setting at very nearly a 70% rural designation. That'll become important as I explain some of the ins and outs of the program. So the Healthcare Connect Fund actually comes from the Telecommunications Act that the FCC implemented in 1996. The way that it initially shook out was through the primary program and the pilot program. We were a part of the pilot program, which funded 69 different entities around the country to set up networks like the Indiana Telehealth Network, like the Colorado Telehealth Network that Beth mentioned. Those provided an 85% subsidy for, as I said, construction, installation, and monthly recurring charges associated with broadband. Now, that has sunset, but out of both the primary and pilot program, you'll see that there were initially 3 planned programs moving forward. First is the Healthcare Connect Fund, which we're talking about today. The second was the Telecommunications program, which was just an extension of the primary program, which is really not germane to this discussion, but provided slightly different like telephone and basic internet, whereas we were more interested in the broadband and fiber. And the skilled nursing pilot program, it was planned for a pilot program, but instead of going ahead with a pilot, what we're here to talk about today is the fact that, well, everybody's new in Virginia, but skilled nursing facilities, I want to let you know, are now eligible as of January 1st, 2017. So the blue bubble there on the bottom is actually going to be folded into the yellow bubble of the Healthcare Connect Fund. And there will not be a skilled nursing pilot program specifically. So what is the Healthcare Connect Fund? Well, it is $400 million annually to help build and extend fiber and broadband around the country, especially into rural areas and especially to nonprofit healthcare providers. It is awarded first come, first serve. So at the end of the year, if that $400 million has been used up, you can't ask for more. It's already been designated. The year usually is from July 1 through June 30th. That's how their funding years work. They are allowing under the Healthcare Connect Fund both consortium filers and individual filers. If you want to file individually, you are welcome to do so, but you must have a rural designation. If you file as part of a consortium, which is what Beth is trying to put together, you have a bunch of benefits, including the fact that we can also bring on urban participants, not just rural participants. It's a very, very nice little perk of being part of consortium. You're not only helping out if you have rural and urban sites, but you're helping out your other friends and partners around the state that might have urban-only facilities that we can help fund with your participation. The big difference between Healthcare Connect Fund and the pilot program is that it is a 65% reimbursement as opposed to the original 85% reimbursement. Of course, we wish it was 100%, but we'll take what we can get. 65 is certainly better than nothing. And we can cover both non-recurring, which would be your construction installation, and monthly recurring, which is just your monthly cost. There is a cap on non-recurring costs of $50,000, but there are some different rules that go into that, and it's really a case-by-case basis, so I don't want to get too much into that today. So who's eligible for this funding? I've sort of touched on it, but public and nonprofit healthcare providers. So I'm very sorry for the for-profit entities out there, but at this point you are not eligible for the funding. It's only for rural participants unless you participate in a consortium, and then you can have a consortium as long as there's a 51% rural designation, and as I said, we're currently at 70%. As long as you maintain that 51% rural designation in your consortium, you're fine, everybody's eligible. And we can even do large HCPs, not just the little critical access hospitals, as long as we adhere to some of those support caps I talked about earlier. But again, that's case-by-case basis. So what can be supported under these programs? We can take care of your broadband services, your installation charges, any equipment necessary to make your service functional. So I want to be clear about that. We can cover things like routers, pretty much any equipment used to light your fiber, but we can't cover anything with, we can't handle, cameras to provide the telehealth services or the telemedicine services. We can only cover the equipment up to lighting your fiber at your facility. Another nice thing about participating in a consortium is that we can cover connections to offsite admin and data centers. These are typically not eligible if you're filing as an individual because you must be a healthcare provider. But if you are a consortium filer and you have an administrative site or a data center where healthcare services are not provided, we can still cover those under a consortium. And then if you have any connections to research and education networks, consortiums can help you cover those as well. All of this work is done as part of the FCC's Rural Healthcare Program, but the administrative organization that they utilize is the Universal Service Administration Company, or Administrative Company. They handle all of the paperwork that we submit on your behalf. They are the ones that are kind of the gatekeepers for the funding as far as the FCC is concerned. Beth, I'm getting some feedback. Is that on my end, or
I don't have anything, so I think
not
it's on your end.
anything?
No.
Okay, well, maybe just my end then. Okay, so what do you get if you participate in a consortium? Well, here are the things that the consortium leader will do for you. We will file your Form 460, which is a form that determines your eligibility through verifying rural, that you are in fact rural, that the services you provide are eligible. We go through your nonprofit tax ID, your national provider identification number, your taxonomy codes, etc. Once you are determined to be eligible, then we file your Form 461, which compiles you as part of the consortium, puts together a request for proposal. We have developed a network plan, attachments A and B, which are detailed lists of both the sites that will be participating and the services line by line that they will be requesting. We've also put together a master contract that's been approved by USAC and the FCC. It meets all the needs of the program. We've had it vetted by several different legal consultants, so it has been completely approved. Once we go through the 461 process, we begin the 462 form, which is a bidding process. I don't want to call it lengthy, but it typically lasts anywhere between 2 to 4 months. It includes question and answer, site visits, letters of intent. We take bids from any interested vendors. We solicit bids from any interested vendors. We handle the scoring process. We solicit best and final bids after the scoring process has been completed. We put together the winning contracts and a very extensive line item funding request that is just a very massive and daunting Excel sheet. But that's where we would actually request the dollars for services. And then finally, for the life of the contract, we end up filing Form 463s for you, which is the invoicing process. We keep track of proof of payment. We facilitate the entire reimbursement process. I know there's a lot of information in this slide, but what you're probably more interested in is, what do you have to do? If that's what the consortium leader has to do, what do you have to do? Well, you have to sign a letter engaging the consortium provider. You have to sign a letter giving them agency to file on your behalf. Once the bid process is over, you pick your winning contract, you sign it, and then you pay your bill. So, Beth, if you want to go back one, this is what the consortium leader does, and this is what you do. It's a very streamlined process. I just want to really stress the ease and the preferential experience you will have by working with a consortium leader. We're very, very good at what we do. We're happy to help the Virginia Telehealth Consortium get together and get going. So it's a very easy process for the healthcare providers when you participate with a consortium. So what will you have to pay as a healthcare provider participating in the Healthcare Connect Fund? Well, we can cover up to 65% of your costs. So the least you might have to pay is only 35% of your rural or monthly recurring charges, and as little as 35% of your non-recurring charges. Now, if there are any fees above that additional $50,000 cap, you would be responsible for those as well. But again, case-by-case basis. and we really wouldn't know until we accepted your bids what those might look like. But you can also seek alternate funding for that up to 35% and over $50,000 cap. We have had a lot of success by working with local economic development groups who want to get fiber built into their areas, and they can easily use clinics and hospitals to be an anchor institution. You can get grants from other places. We've had a lot of success with USDA grants in the past. Honestly, the only place you cannot seek additional funding is from other FCC programs and universal service funds.
Yeah, and I think that's an important point to reemphasize, because a lot of federal money, you can't match federal with federal, but in this case, as long as the money isn't from FCC, it can come from USDA or any other source. So it's not a concern about matching federal with federal for this particular program.
Yeah, absolutely.
All right, so at this point, and this has been a lot of information in a great big hurry, but just breaking down the basic options for our rural healthcare providers. Option one, of course, is you can do nothing. You can look at this and say, hey, this is not for us, and that's fine. Your second option is you can apply for the funding and go through the process on your own. One option is you can work with a consultant. We have several consultants that are willing to work with Virginia entities to help them pull down these funds. Or, of course, what we're talking about today is you can choose to join the Virginia Rural Health Telecommunications Consortium and have us do all this fun stuff for you. So those are the options, and we can definitely talk about those details more later. So overall for Virginia, our next step, number one, we are working on identifying eligible sites. Jim, in your case, Stone Mountain Health Services has 13 sites that are potentially eligible. So we'll be doing that, asking you to complete that needs assessment, determine who actually wants to join the consortium, and then fill out all those forms and submit the request. So with that, and going back to some of what Allie was talking about earlier, with the consortium, sites which are, quote, urban can participate as long as at least 51% of the sites in the consortium are rural. And of course, we know that those federal rural designations are pretty tight. So in this case, Jim, with Stone Mountain, Lee County counts as rural and Wise County counts as rural, but Giles County does not. So one of the benefits of having Stone Mountain sign up, since you've got 13 sites, that means that pretty much all of the sites in Giles County could also participate because they are not, quote, rural, by the FCC standards. So, Giles County could participate, the sites in Craig County could participate, all those places that we look at and we say, who on earth decided that this was not rural, they could also be part of this process. So with that, I want to open it up to questions here and see what else anybody wants to know. If I can find my little question box in this whole thing. I know it exists. All right, Jim, did you have any questions at this point, since it looks like you're still the only one on? Oh, there's another question box. Ha! All right. So with that, I think we'll go ahead and wrap this up for today. Jim, you certainly know how to find me if you have other questions, and we will go from here. Thanks, everybody.